My name is Antoni Martinez-Rubio. I'm a physician, cardiologist from the University Hospital of Sabadell. This is one of the autonomic university hospitals from Barcelona. I have just talked about low dosing direct oral anticoagulants in atrial fibrillation. If it is this low dosing appropriate, justified, and what is happening in clinical practice. It's surely justified because there are patients who have a higher risk of bleeding. They are well known. This depends mainly on age of the patients and also on renal function. Therefore, we have reviewed the pivotal trials. The 4 pivotal trials of DOACs included 2 dosing of the drug in different subsets of patients. However, this low dosing was used in a very small sample of patients who underwent the studies with apixaban, rivaroxaban, or edoxaban. In contrast with dabigatran, patients were randomized to 1 of 2 doses of dabigatran, 150 or 110 milligrams twice per day, and depending of renal function or of age. Then we have reviewed that the indications of what is happening in clinical practice. This shows us that these low doses are used in clinical practice much more than should be. So we are underdosing very often patients in different subsets of clinical situations. We have also some patients undergoing overdosing, but this is a more rare situation, and especially the underdosing situation brings the patients in danger of losing the efficacy and also losing safety, because they are going to have much more critical events if we are trying to save major bleeding, but we are losing our capacity to avoid strokes or thromboembolism at any territorium. So in summary, low dosing is appropriate, but only for special subsets of patients. Physicians must be very aware that this low dosing has been only really tested with a statistical power for dabigatran, not for the other drugs. Then in clinical practice, we are underdosing very often and uncommonly, but also sometimes overdosing, which exposes to bleeding. And therefore, we should take a lot of care on giving the appropriate knowledge to our colleagues and also the appropriate dosing for our patients.